Aloha, my name is Hilda Vitalis, presenting an educational project regarding heart failure education delivered through home based primary care at Kona NP LLC. Heart failure often leads to hospital visit and readmission, especially for patients with limited healthcare access. Those in rural home based setting may face challenges like transportation problems, low health literacy, and caregiver stress, which can affect the implementation of treatment plans. This project took place at Kona NP LLC, a privately owned home based primary care practice led by Cynthia Ventanilla, APRN. The practice focuses on bringing healthcare directly to patients in their homes, which is especially important for individuals who face challenges with transportation, mobility, or access to clinic based services. Implementing this project required teamwork and collaboration between the nurse practitioners, caregivers, patients, and CNAs. Each group played an important role. Patients learned how to better manage their condition, caregivers provided daily support, CNAs assisted with monitoring and care, and the provider offered structured education and follow up. Knowledge to action framework guided the process, helping translate best evidence into practical strategies that could be applied in the home setting. This approach ensured that the education was not only evidence based, but also realistic, sustainable, and centered around the patient's daily life. Heart failure affects approximately 6.7 million adults in the United States. Rural and community patients face higher barriers to care. Patients receiving home based care often have higher risk due to the health literacy issues, caregiver challenges, and limited access to the hospital based education. This made a home intervention especially important. This project was designed to align with the Healthy People 2030 objective, HDS09, reducing heart failure hospitalization among adults. The project aimed to improve knowledge and self care in patients with heart failure through structured education delivered during home visits over 8 weeks. Progress was measured using the Self Care of Heart Failure Index, pre and post intervention to evaluate improvements in patient knowledge and confidence. The intervention was feasible within the routine home visit and provided opportunities for patients to ask questions and clarify information. The education was relevant to reducing rehospitalization as improved understanding of symptoms management, medication adherence, and lifestyle modification supports better outcomes. By the conclusion of the project, most of the participants demonstrated increased confidence in managing heart failure and recognizing early warning signs requiring medical attention. The structured education and data collection were carried out during home visits by the nurse. This approach allowed teaching to occur in the patient's own environment, making it easier for demonstration self care techniques, answer questions immediately, and observe any barriers to following recommendations. Using the Self Care of Heart Failure Index provided a standardized way to measure patients' knowledge and confidence before and after education. Collecting responses directly from patients and caregivers help ensure accurate assessment of understanding and engagement. The project was conducted in the patient's home through Kona NP LLC, which allowed teaching to be highly personalized. Education was tailored to each patient's literacy level, cognitive ability, and presence of caregivers, ensuring that instructions were understandable and practical. Real life examples were emphasized, such as reviewing actual medication bottles, discussing food choices, and demonstrating symptom tracking and daily routines. This approach help patients and caregivers apply education directly to their own environment, improving understanding and supporting effective self management. Teaching in the home also allows identification of potential barriers, such as difficulty preparing their meals or remembering medications, so strategies can be provided to address these challenges. The implementation followed a structured four-step process to improve heart failure self care. First, a baseline self care of heart failure index was collected to assess patients' current knowledge and behaviors. Next, nurse led education focused on recognizing symptoms, proper medication use, diet, and fluid management, allowing patients to learn practical strategies in their own homes. The teach back method was used during education where patients and caregivers were asked to repeat instructions in their own words to confirm understanding and reinforce learning. Caregivers were actively involved in supporting patients in daily routines and reinforcing education. Finally, a post intervention self care heart failure index was completed to measure changes in knowledge and self care practices. This approach allowed the intervention to be tailored to each patient's abilities and support system while maintaining a consistent educational framework. This QR code is the link to the heart failure education video presented to the patients, caregivers, and CNAs. This QR code and the YouTube link were also sent to the patients and their caregivers so, so that they could watch and access the PowerPoint at their own convenience. The project was evaluated using several methods. Patients completed the self care of heart failure index before and after the education. The teach back method was used to check patients' understanding, and the feedback was gathered from both patients and caregivers. The results showed an increase in patient self care knowledge and confidence after receiving structured home based education. Caregiver participation also improved, which made it easier for patients to follow instructions about diet, medications, and daily monitoring. The project showed progress towards reducing rehospitalization, although the overall goal was only partially met. Patients who were more independent and able to manage their own care showed the strongest improvements in self care knowledge and confidence. However, patients with greater dependence still require significant caregiver support. One of the main lessons was the importance of collaboration. When patients, caregivers, and healthcare providers worked together, education was more effective and the care plans were followed more consistently. While we were not able to completely prevent readmissions, the gains in patient knowledge, caregiver involvement, and trust building are strong indicators that these strategies can lead to better long term outcomes. Structured home based education improved patients' knowledge and confidence in managing heart failure, and caregiver participation increased. Many caregivers reported feeling less stress once they had clearer guidance on daily care. Education in the home setting, learning more practical as patients and caregivers could use real examples such as medication bottles, food in the kitchen, or tracking tools. Building trust during home visits was critical, as patients felt more comfortable sharing challenges in their own environment. Caregiver support was just important as patient learning through challenges remained for those with limited caregiver support and memory problems. To keep the improvements going, it is important to strengthen caregiver training. Caregivers are often the main source of daily support, and structured training modules can help them feel more confident and reduce stress while caring for patients with heart failure. For patients with memory problems and other cognitive impairments, strategies must be tailored, such as breaking information into smaller steps, repeating instructions, and using visual cues. Technology can also be a powerful tool to support learning at home. Digital reminders, educational videos, and more mobile apps can reinforce all what is taught during visits and provide ongoing guidance while the nurse or the provider is not present. These approaches can help patients and caregivers stay engaged, follow care plans more consistently, and prevent avoidable hospital readmissions. Providing heart failure education in the home setting help improve patient knowledge, gave caregivers more confidence in managing daily care, and directly support the Healthy People 2030 goal, HDS-09. Research also showed that home-based teaching can improve long-term long-term outcomes when caregivers are actively involved. Sustainability depends on caregiver engagement, reinforced from nurses and CNAs, and using digital tools like videos or reminders keep patients and families on track. The QR code was made for easy access of the heart failure PowerPoint video. In conclusion, education delivered through Kona and PLLC proved effective and aligns with national priorities, but its success depends on the continuous teamwork and the modern follow-up strategies. Please scan the QR code to view the references used in this project. Thank you for viewing. Mahalo.